The committee room fell silent as Senator Ron Johnson leaned forward, a smirk spreading across his face. What he said next would shock the nation and ignite a political firestorm that's still burning today. Just moments after Representative Jasmine Crockett finished her opening statement about healthcare disparities, Johnson decided to launch a personal attack that no one saw coming. "Representative Crockett," he began, his voice dripping with condescension, "maybe someone with your background should focus on issues you actually understand instead of lecturing the rest of us about complex policy matters." The room erupted. Cameras captured every reaction, but what Jasmine Crockett did next didn't just silence Johnson. It made him storm out of the hearing in complete humiliation, leaving behind a moment that would define both their careers forever. This wasn't just another political disagreement. This was the moment a seasoned senator learned you don't come for a brilliant young congresswoman unless you're ready for a fight you can't win. Before we dive into exactly how Crockett dismantled Johnson piece by piece, hit that like button and subscribe so you never miss these incredible political showdowns. What happened in the next 20 minutes would become legendary. Johnson thought he was dealing with just another freshman representative. He had no idea he was about to face someone who had been preparing for this moment her entire life. To understand why this confrontation became so explosive, you need to know who these two people really are and what they represent in American politics today. Representative Jasmine Crockett walked into Congress as the embodiment of the American dream. Born and raised in St. Louis, Missouri, she grew up in a working-class family where education was everything. Her mother worked double shifts as a nurse while her father drove trucks to make ends meet. They scraped together every penny to make sure their daughter could attend college, knowing that education was her ticket to something better. Crockett didn't just attend college, she excelled. She earned her law degree and quickly became one of the most respected civil rights attorneys in Texas. Before running for Congress, she spent years fighting for families who couldn't afford justice, taking on cases that other lawyers wouldn't touch because the clients couldn't pay big fees. She specialized in housing discrimination, police misconduct, and voting rights, the kind of law that makes real change in real people's lives. When she won her congressional seat, she brought that same fighting spirit to Washington. At 33 years old, she represents a new generation of leaders who refuse to play by the old rules of staying quiet and waiting their turn. She's known for her sharp legal mind, her passionate speeches about social justice, and her ability to break down complex issues in ways that regular people can understand. On the other side of this confrontation sits Senator Ron Johnson from Wisconsin. At 69 years old, he's been in the Senate for over a decade, building his reputation as someone who doesn't hesitate to engage in political combat. Johnson made his fortune in business before entering politics, and he's never been shy about using his platform to challenge opponents, especially those he considers inexperienced. Johnson has a history of controversial statements and confrontational moments in hearings. He's known for his aggressive questioning style and his willingness to make personal attacks when he feels threatened politically. Some see him as a straight-talking conservative who tells hard truths. Others view him as someone who crosses lines that shouldn't be crossed. The stakes of this particular hearing couldn't have been higher. They were discussing a major healthcare bill that would affect millions of Americans, particularly communities of color who face significant health disparities. Crockett had been invited to testify about how these disparities impact her constituents in Dallas, bringing real-world expertise from her legal background and personal experience. For Johnson, this was about politics and power. He saw an opportunity to score points with his base by challenging a young progressive congresswoman who represents everything his supporters oppose. For Crockett, this was deeply personal. She was fighting for her community, her constituents, and her right to be taken seriously in a chamber where people like her historically haven't been welcome. Neither of them knew that this moment would become a defining example of how generational and cultural divides play out in modern American politics. Johnson expected to easily dismiss a freshman representative. Crockett came prepared to defend not just her position, but her dignity and her right to be heard. The tension in the committee room had been building all morning. Senator Johnson had already made several pointed comments during other testimonies, clearly agitated by the direction of the hearing. When Representative Crockett was called to speak, you could feel the electricity in the air. Crockett approached the microphone with confidence, her posture straight and her voice clear. She began her testimony by sharing statistics about healthcare disparities in her district, numbers that painted a stark picture of inequality. African American mothers in her district were 3 times more likely to die in childbirth than white mothers. Children in predominantly minority schools had asthma rates that were off the charts due to environmental factors. Diabetes and heart disease were ravaging communities that couldn't afford preventive care. But Crockett didn't just recite statistics. She told stories. She talked about Maria, a single mother of 3 who rationed her insulin because she couldn't afford a full prescription. She described elderly black men in her district who avoided hospitals because they'd been mistreated so many times they'd lost trust in the healthcare system entirely. She spoke about children missing school because their parents couldn't afford to take time off work to take them to the doctor. Her testimony was powerful,